I'm making this video because my actions during the outbreak of COVID-19 could cause people to die.
Concern is growing over a possible outbreak of a new SARS-like virus.
Wuhan in China now on lockdown as the country struggles
the Vatican empty as the country.
We're talking about the mass quarantine. Could something like that happen here in the U.S.?
I think it's definitely possible. You're
not to go out.
Governor Gavin Newsom ordered all 40 million residents to stay at home.
Stay at home.
Stay at home. Stay home.
When people started talking about quarantine, I did what many Americans did. I limited my contact with other people, and I canceled all non-essential plans.
We direct a statewide order for people to stay at home.
One of the plans that I canceled was an appointment to donate blood. I figured it would be better for public health for me to stay at home and healthy than to donate and risk getting infected. But it turns out tens of thousands of other people did the same thing. On March 20th, the AABB, American Blood Centers, and the Red Cross delivered a joint statement to the Department of Health and Human Services, which said that 4,000 blood drives have been canceled due to COVID-19, and 130,000 donations have gone uncollected. And those numbers have only risen since then. So what does this mean for the millions of people who will need transfusions in the coming months? To understand all this, we have to understand what blood does for the body. It's made up of four main components: plasma, which carries nutrients, hormones, and proteins throughout your body; platelets, which help to clot blood when you get it cut; white blood cells, which defend your body against toxins; and red blood cells, which carry oxygen. All these functions are incredibly complex, and because of that, there's never been a viable blood substitute. The only way to replace it is with a process that's more or less stayed the same since World War I. And that's to transfuse blood from another person. But that transfusion has to happen within 42 days or the blood will expire, which means the national blood supply is dependent on regular donations throughout the year. Because of social distancing, that supply is being threatened.
We continue to see more and more sponsors cancel blood drives across the United States. We're going to reach a level of inventory of which we haven't seen in the past.
So what does all this look like? Well, if this guy right here represents 10,000 units, then this is the average amount of blood that's donated each month. And this is the average blood demand. With 325,000 donations going uncollected, that puts us well below the average demand threshold. The unused units from the previous month do roll over, but it isn't enough. Now, blood transfusions are rarely needed for respiratory illnesses like COVID-19, but they are needed for millions of other patients that are already in the hospital or will be in coming months. That includes people going through chemotherapy or those involved in a car accident. And not to mention all the people with anemia or sickle cell disease that rely on blood transfusions to survive. To combat the shortage, hospitals have to ration their blood use. So they delay transfusions that aren't absolutely necessary, they limit the dose for certain patients, and they conserve their supply of O negative, the universal blood type. These protocols are necessary to help the medical system survive a temporary shortage, but if donations stay where they are or continue to decline, there'll be nothing left to ration, and some hospitals are already within a few days of running out. In some cases, like the initial outbreak of COVID-19 in Washington state, local donations declined, so blood was shipped in from other parts of the country. But as the shortage has progressed, there isn't as much of a surplus to provide to the harder hit parts of the country, which means the areas that are most in need of social distancing are also the most in need of blood. But the shortage does have an easy solution. We just need more donations. And it turns out it's encouraged under quarantine by the FDA, the CDC, the Surgeon General, and the White House.
Social distancing does not have to mean social disengagement. So give blood today. You'll feel good about it, and you'll be helping your country and your community during this crisis. And you might even save a life.
That was good enough for me. So I rebooked my appointment, and it turns out in many ways, donating blood is a lot safer than going to the grocery store. And that's because blood drives are operated by medical professionals. Temperatures are monitored and beds are spaced out in accordance with social distancing guidelines. And there's no evidence that COVID-19 can be transmitted by blood. But this isn't a one-time solution. In the wake of the September 11th terrorist attacks, people flocked to blood drives to do their part to help Americans in need. 500,000 extra units of blood were donated in the following months, but only 258 units were needed to treat survivors. So around 200,000 units expired. Once that news got out, people stopped donating, and that surge turned into a drought. The following year, about 1/3 of independent blood banks were at a critical shortage. That's because many of those who gave blood were first-time donors, and only 30% of them donated again. So we need to think of our donations in this time of crisis not as a one-time solution, but as the start to a stronger blood supply. And that can only happen if we continue to donate throughout the year. Donating blood is something that we do for other people because it needs to be done, just like social distancing. So if you're healthy, give the Red Cross a call and let's stop this shortage together.